हेलो फ्रेंड्स, वेलकम टू माय यूट्यूब चैनल नर्सिंग सॉल्यूशंस। सो आज की वीडियो में हम जो अभी पंजाब एमएससी नर्सिंग का एग्जाम हुआ है अंडर बाबा फरीद यूनिवर्सिटी ऑफ हेल्थ साइंसेज, उसके क्वेश्चन पेपर को डिस्कस करेंगे। तो ये जो पेपर था ये 3 आवर्स का था और इसमें टोटल क्वेश्चन थे वो 200 क्वेश्चन थे। तो इसमें जो फर्स्ट क्वेश्चन था वो था द फोर मेजर कंपोनेंट इन नर्सिंग थ्योरी आर द पर्सन इन्वायरमेंट नर्स हेल्थ। ऑप्शन नंबर बी जो था वो था नर्स पर्सन इन्वायरमेंट क्योर। सी ऑप्शन था प्रोमोटिव प्रिवेंटिव क्यूरेटिव और रिहेबिलिटेटिव। और फोर्थ जो था वो था पर्सन इन्वायरमेंट नर्सिंग और हेल्थ। तो इसका जो करेक्ट आंसर है वो है ऑप्शन नंबर डी। तो जो मेजर कंपोनेंट्स होते हैं हमारे नर्सिंग थ्योरी के वो होते हैं पर्सन इन्वायरमेंट नर्सिंग और हेल्थ। इसके बाद हमारा सेकंड क्वेश्चन था द कोड ऑफ एथिक्स फॉर नर्सेस इंक्लूड एक्सेप्ट। एंड द ऑप्शन जो थे वो थे द प्राइमरी रिस्पॉन्सिबिलिटी ऑफ नर्स इज टू प्रोवाइड केयर टू दोज पीपल हु रिक्वायर इट। अ नर्स इज नॉट रिस्पॉन्सिबल फॉर मेंटेनिंग हाईएस्ट स्टैंडर्ड ऑफ नर्सिंग केयर। ऑप्शन नंबर सी था ए नर्स मेंटेन अ कोऑपरेटिव रिलेशनशिप विद कोवर्कर्स। एंड ऑप्शन नंबर डी जो था वो था द नर्स शेयर्स विद अदर सिटीजन द रिस्पॉन्सिबिलिटी फॉर इनिशिएटिंग एंड सपोर्टिंग एक्शन टू मीट द हेल्थ नीड ऑफ द पब्लिक। तो इसमें जो करेक्ट आंसर रहेगा दैट इज ऑप्शन नंबर बी। तो इसमें एक्सेप्ट पूछा था तो ऑप्शन नंबर ए और सी और डी जो है वो हमारे कोड ऑफ एथिक्स के पार्ट है। लेकिन जो बी है दैट इज नर्स इज नॉट रिस्पॉन्सिबल फॉर मेंटेनिंग हाईएस्ट स्टैंडर्ड ऑफ नर्सिंग केयर, दैट इज नॉट इंक्लूडेड इन कोड ऑफ एथिक्स। इसके बाद ऑप्शन नंबर क्वेश्चन नंबर जो 3 था वो था A failure in professional duty, practice or skill that leads to injury or harm to the patient is termed as malpractice, negligence, crime or misunderstanding. तो इसमें जो ऑप्शन नंबर ए है that is the right answer. This is known as malpractice. Now next question was Indian Red Cross Society was established in. तो इसमें जो इसका right answer है that is option number B. जो इंडियन रेड क्रॉस सोसाइटी है वो 1920 में एस्टेब्लिश हुई थी। इसके बाद जो नेक्स्ट क्वेश्चन है वो है आफ्टर रजिस्ट्रेशन इन वन स्टेट नर्सिंग काउंसिल द कंडीशन ऑफ म्यूचुअल रिकॉग्नाइजेशन बाय द अदर स्टेट नर्सिंग रजिस्ट्रेशन काउंसिल इज टर्म्ड एज कोड ऑफ एथिक्स, रेसिप्रोसिटी, यूनिफॉर्मिटी और डी था रेड सेंट। तो इसमें जो राइट आंसर है दैट इज अगेन ऑप्शन नंबर बी, दैट इट्स दिस इज नोन एज रेसिप्रोसिटी। नेक्स्ट था गोबी कैंपेन इज बीइंग प्रमोटेड बाय WHO, यूनिसेफ, केयर और UNDP। तो हमें सबको पता है कि जो हमारा गोबी कैंपेन है दैट इज डन बाय प्रमोटेड बाय यूनिसेफ। और अभी जो गोबी है दैट इज नोन एज गोबी 3F, जिसमें G स्टैंड्स फॉर ग्रोथ मॉनिटरिंग, O फॉर ORS, B फॉर ब्रेस्ट फीडिंग, I फॉर इम्यूनाइजेशन और इसके बाद इसमें 3F है दैट इज फीमेल एजुकेशन, फूड एंड फैमिली प्लानिंग। इसके बाद हमारा नेक्स्ट था द टेक्निक ऑफ काउंसलिंग इन विच इंटेलेक्चुअल एस्पेक्ट आर मोर सिग्निफिकेंट देन द इमोशनल एस्पेक्ट इज टर्म्ड एज एंड काउंसलर सेंटर्ड काउंसलिंग, क्लाइंट सेंटर्ड काउंसलिंग, इलेक्टिव काउंसलिंग और सुपरवाइजरी काउंसलिंग। तो इसमें जो करेक्ट आंसर है दैट इज ऑप्शन नंबर ए, दैट दिस टाइप ऑफ काउंसलिंग टेक्निक इज नोन एज काउंसलर सेंटर्ड काउंसलिंग। इसके बाद नेक्स्ट क्वेश्चन था which among the following leadership style is most effective? तो that is option number C, democratic leadership जो है that is the most effective leadership among all those which is given in the options. इसके बाद next question था the research design in which the investigator studies the life experience of individual in their life world is called and ethnography, ethology, grounded theory or phenomenology. So the right answer is phenomenology. Means when we are investigating the life experience of any individual, that individual can be the tsunami victims, rape victims. तो जब भी हम उनके लाइफ एक्सपीरियंसेस को इन्वेस्टिगेट करते हैं तो दैट टाइप ऑफ स्टडी इज नोन एज फिनोमिनोलॉजी स्टडी। देन ऑप्शन नंबर 10 जो क्वेश्चन नंबर 10 था कि विच अमंग द फॉलोइंग इज अ पॉजिटिव सिम्टम ऑफ स्किज़ोफ्रेनिया। सो blunted affect, delusion, loss of motivation और एनिडोनिया। तो पॉजिटिव सिम्टम मीन्स जो कि एड ऑन हो रहे हैं हमारे पर्सन के अंदर, तो दैट इज डिल्यूशन। इसके अलावा बाकी जो 3 ऑप्शन है दे आर द नेगेटिव सिम्टम्स ऑफ स्किज़ोफ्रेनिया. The next is in brain that all are seen except, and the options are diabetes insipidus, apnea, constricted pupil और pulse rate unresponsive to atropine. तो इन्होंने इसमें except पूछा है, so that is option number C, that is constricted pupil is not seen in brain death. Now the next is when does discharge planning ideally begin? And the options are during admission, after admission, before admission or without admission. So we all know कि जो हमारी discharge planning है वो during admission ही start हो जाती है. Now the next is gender, age, religion and blood group are measured as nominal scale, ordinal scale, interval scale और रेशियो स्केल. सो इसमें जो हमारा राइट आंसर है दैट इज नॉमिनल स्केल. हम इनको ऐसे नॉमिनल स्केल मेजर करते हैं. इसमें हम ऑर्डर वाइज कुछ भी नहीं है, अगर मेल फीमेल हो तो हम उसमें ऑर्डिनल स्केल यूज करेंगे. देन द नेक्स्ट इज the pediatrician nurse instruct parents who are concerned about spread of illness in their children's daycare center to inquire about the facilities. So the right answer will be the infection control practices. ठीक है, अगर हमने कहीं पे भी देखना है कि किसी भी स्प्रेड ऑफ डिजीज को कंट्रोल करने के लिए किसी भी एरिया में जो इसकी इन्फेक्शन कंट्रोल प्रैक्टिसेस हैं वो कैसी हैं. इसके बाद हमारा नेक्स्ट क्वेश्चन था नॉर्मल पोजीशन ऑफ यूट्रस इज. सो इसमें जो राइट आंसर है दैट इज ऑप्शन नंबर डी, दैट इज एंटीवर्टेड एंटीफ्लेक्स्ड. Then the next is the evaluation of nursing care by examining the records and charts of discharged patient is known as. So the right answer is retrospective audit. कि हम बैकवर्ड ऑडिट कर रहे हैं, ऑलरेडी जो पेशेंट है वो डिस्चार्ज हो चुका है, उसके बस रिकॉर्डिंग एंड रिपोर्टिंग को देख के हम ऑडिट जो इवैल्यूएशन कर रहे हैं. Then the next is a 4-year-old child whose family follows a strict vegetarian diet undergo physical examination at the pre-kindergarten. So the pediatric nurse is alert to child potential deficiency of niacin, vitamin B12, B6 or B6 or B12. So right answer is option number D, that is B12, because जो strict vegetarian होते हैं उनमें कौन सी deficiency ज़्यादा देखने को मिलती है? Vitamin B12, because vitamin B12 is present in non-vegetarian food. इसके बाद हमारा नेक्स्ट क्वेश्चन था PNAI was established in 1905, 1922, 37 or 45. So the right answer is option number A. The PNAI was established in the year 1905. Now the next is marked softening of cervix during antenatal period is known as Schindler sign, Goodell sign, Jackmire sign or Hegel sign. So the right answer is option number B, that is Goodell sign. Next question था objectives of nursing supervision include or accept promote communication, initiate disciplinary actions, promote motivation or evaluate and improve performance. So the right answer is option number B, that is initiate disciplinary action. तो इसके अलावा जो 3 options हैं they are the objectives of nursing supervision, but the initiate disciplinary action है that is not a part of nursing supervision. Now the next is a child diagnosed with the pathology of Fallot become upset, crying and crashing around when a blood specimen is obtained. The child's color becomes blue and respiratory rate increases to 44 beats per minute. Which of the following action would the nurse do first? तो इसमें जो हमारा करेक्ट आंसर है that is option number D, because the ideal position for pathology of Fallot is place the child in knee chest position. Now the next is beriberi is caused by the deficiency of which vitamin? So the right answer is option number A, that is vitamin B12. Sorry, vitamin B1. Option number A is vitamin B1. Then the next is athlete foot is caused by bacterial infection, allergy, virus or fungus. So the right answer is fungus. The athlete foot that is caused by fungus. Now the next question is the placental development will complete in the following gestational week, and the options are 6 weeks, 8 weeks, 10 weeks, 12 weeks. So the right answer is 12 weeks. Now the next question वो था कि dash is not a congenital anomaly. So the right answer will be aneurysm because it is a bedwetting. इसके अलावा जो बाकी 3 conditions हैं diaphragmatic hernia, imperforate anus and spina bifida, these all are the congenital anomalies. Now the next is the independent variable refer to one of the following and the options are result, cause, effect and output. So the right answer is cause. Cause will be the independent variable whereas effect will be the dependent variable. Now the next is sunset eyes are seen in hydrocephalus. The right answer will be the hydrocephalus. Now the next is the following steps are involved in communication process except. तो इसमें जो राइट आंसर रहेगा दैट इज ऑप्शन नंबर डी इवैल्यूएशन. इवैल्यूएशन जो है वो कभी भी कम्युनिकेशन प्रोसेस का पार्ट नहीं होता है. नाउ द नेक्स्ट इज हु डिस्कवर्ड माइक्रोस्कोप फर्स्ट टाइम. तो द राइट आंसर इज ऑप्शन नंबर सी. इसके अलावा नेक्स्ट क्वेश्चन था द डिवाइस दैट इज यूज्ड बाय रिसर्चर टू कलेक्ट डाटा फॉर अ स्टडी इज कॉल्ड. तो द राइट आंसर विल बी द इंस्ट्रूमेंट. तो ऑप्शन नंबर सी जो है that is the right answer. Now the next is a female client who received general anesthesia returned from surgery post-operatively. Which nursing diagnosis took the highest priority for the client? So इसमें जो option number D है that will be the right answer. The risk for aspiration related to anesthesia will be the highest nursing diagnosis for the patient. Now the next is presence of pathogenic bacteria is the blood is known as toxemia, septicemia, bacteremia, or all of the above. So they have asked about the bacteria. So the right answer will be the bacteremia. So option number C is the right answer. The next question is a pregnant female, a pregnant client is diagnosed with partial placenta previa. In explaining the diagnosis, the nurse tells the client that the usual treatment for partial placenta previa in which of the following? Activity limited to bed rest, placental platelet infusion, immediate cesarean delivery, or labor induction with oxytocin. So the right answer will be the option number A, that is activity limited to the bed rest because the female is having partial placental previa. अगर complete placenta previa होता तो immediate cesarean delivery can be the right option for that. Now the next is a 31-year-old multi-para is admitted to the labor room after initial examination reveals her cervix to be at 8 centimeter completely phased and at 0 station. Which phase of labor is she in? So इसमें जो ऑप्शन नंबर डी है दैट इज ट्रांजिशनल फेज बिकॉज 8 to 10 सेंटीमीटर का जो डायलिटेशन होता है दैट फेज इज नोन एज ट्रांजिशनल फेज. नाउ द नेक्स्ट इज द डॉक्टर ऑर्डर्ड एन IV bolus. The order says to administer IV now 12.5 mg. You are supplied with a vial that is labeled 50 mg per ml. How many ml will you drawn up and administer per dose? So dose in hand divided by dose available dose divided by dose in hand into volume वाला फॉर्मूला हम पुट करेंगे. तो उसमें जो हमारा राइट आंसर आएगा दैट विल बी द ऑप्शन नंबर बी दैट इज 0.25 ml per dose. Now the next is during labor and delivery, mother receives spinal anesthesia. After 24 hours, she complains of headache. The nurse recognizes that this is a reaction of anesthesia when client states, my headache improves when I sit up. My headache gets better as soon as I walk a while. My head hurts worse when I'm resting flat in the bed. My head hurts worse when I'm sitting up feeding the baby. So इसमें जो ऑप्शन नंबर B है that is the right answer that suggests that the female is having this headache due to the reaction of anesthesia. Now the next is using Maslow's hierarchy of needs, a nurse assigning the highest priority to which client need. तो इसमें जो राइट आंसर है दैट इज ऑप्शन नंबर ए दैट इज एलिमिनेशन. ठीक है, जो हमारी फिजिकल नीड्स है वो हमारी हाईएस्ट प्रायोरिटी में रहेंगी. Now the next is a pregnant lady asks the nurse how smoking will affect the baby. Nurse answer is based on following knowledge. And the options are the placenta is permeable to specific substances. Smoking relieves tension and fetus respond accordingly. Vasoconstriction will affect both maternal and fetal blood vessel. Fetal and maternal circulation are separated by placental barriers. So option number C is the right answer because in smoking nicotine is present and nicotine will lead to vasoconstriction. So due to which there will be the effect on the maternal and fetal blood vessels. Now the next is a primate Brevida is unsure of LMP. The physician tells her that she appears to be about 20 weeks pregnant. The nurse explains that this is because of the fundus. तो इसमें जो right answer है that is option number D. Because at 20 weeks जो umbilicus हमारा fundus होता है that is at umbilicus and FHR जो है वो हम stethoscope से मतलब we can hear the FHR with the help of fetoscope or the stethoscope. So the right answer will be the option number D. Now the next is during delivery, the midwife perform an episiotomy. The nurse explains the mother that this action commonly performed to prevent laceration during birth. So the main जो हमारा objective होता है, जो main purpose होता है episiotomy का, वो यही होता है कि जो हमारी पेरिनियल लेसरेशन है हम उसको प्रिवेंट कर सके ताकि जो हमारी बर्थ कैनाल है हम उसको ब्रॉड कर सके. नाउ द नेक्स्ट इज सिक टेस्ट इज डन फॉर द डायग्नोसिस ऑफ. सो द राइट आंसर इज ऑप्शन नंबर सी दैट इज डिप्थीरिया. तो जो सिक टेस्ट है वो हम डिप्थीरिया के लिए करते हैं. नाउ द नेक्स्ट इज द डॉक्टर राइट्स एन ऑर्डर फॉर लिक्विड ओरल मेडिकेशन. The doctor says to administer 15 mg by mouth every 4 hours as needed for sore throat. Pharmacy dispenses you with 30 mg per ml. So how many ml will you administer per dose? So again इसमें the dose in hand divided by available dose into volume अगर हम formula put करते हैं तो that will give us 1.5 ml per dose. Now the next is after completion of basic nursing education, a nurse needs to register with following to practice as RN and RM. So the right answer is option number B, that is State Nursing Council. तो अगर आप जिस भी स्टेट से पास आउट हो रहे हैं तो बिफोर गोइंग फॉर द प्रैक्टिस हमने उसी स्टेट से जो हमारी रजिस्ट्रेशन है उसको वी आर सपोज टू गेट आवर रजिस्टर्ड नंबर. Now, which of the following would the nurse most likely to expect to find when assessing a pregnant client with abruptio placenta? So, excessive vaginal bleeding, rigid broad-like abdomen, titanic uterine contraction, premature rupture of membrane. So, in the abruptio placenta, the bleeding can be revealed, it can be concealed. So, the female may be present with rigid broad-like abdomen. Now the next question is, independent nursing intervention commonly used for patient with pressure ulcer include. So इसमें जो हमारा right answer रहेगा that is option number A, that is changing the position regularly to minimize the pressure, because इसके अलावा जो जितने भी options हैं उन सबके लिए we need a written prescription from a physician. Now the next is, a client is diagnosed with Wills tumor. During assessment, the pediatric nurse should expect to detect, and the options are gross hematuria, dysuria, nausea and vomiting, or abdominal mass. So in the Wills tumor, we will find the abdominal mass. Now the next is question number 47. Petite mal seizures are characterized by infrequent occurrence, frequent association with vocalization, aura preceding the incident, or induction by hyperventilation. So this type of seizure are characterized by induction of hyperventilation. Now the next is, which of the following best describe parallel play between two toddlers? So जो parallel play है वो हमें toddlers में देखने को मिलता है तो इसमें जो राइट आंसर रहेगा दैट विल बी द सिटिंग नियर ईच अदर व्हाइल प्लेइंग विद देयर टॉयज. नाउ द नेक्स्ट इज which of the respiratory condition is always treated as medical emergency. तो इसमें जो हमारा राइट आंसर है दैट इज ऑप्शन नंबर सी, एपिग्लॉटिस. एपिग्लॉटिस जो है वो हमारी एक मेडिकल इमरजेंसी है. नाउ द नेक्स्ट इज which intervention should the nurse in charge try first for a client that exhibits sign of sleep disturbance. So right answer is option number D, that is provide the client normal sleep aids such as pillow, back rub and snacks. Now the next is the most appropriate precaution for the staff of a hospital unit can take to minimize the communicability of diarrhea is to. So the main means precautionary measure जो है that is washing hand. ठीक है, wash their hands properly after each diaper change. Now the next is which of the following is most consistent with non-organic recurring abdominal pain in children? So symptoms are aggravated during time of tension or stress. The pain does not completely resolve during interval between episodes. An intra-abdominal abnormality is demonstrable in most cases and pain is localized. So most consistent with non-organic abdominal pain है. So the option is the symptom will be aggravated during time of tension or stress. जो बच्चा होगा जब भी टाइम स्ट्रेस होगा, जो टेंशन होगी उस टाइम पे जो उसके सिम्टम्स होंगे वो और ज्यादा इंक्रीज हो जाएंगे. Now the next is which of the following can indicate left-sided heart failure in an infant? So the option is fever, low appetite, increased respiratory rate or crying. So the right answer will be the increased respiratory rate. Now the next is the mother of a 3-year-old with esophageal reflux asks the nurse what she can do to lessen the baby's reflex. The nurse should tell the mother to feed the baby only when he is hungry, burp the baby after feeding is completed, place the baby in supine and head elevated, or burp the baby frequently throughout the feeding. So the right answer will be the burp the baby frequently throughout the feeding. Now the next is which of the following assessment finding would lead the nurse to suspect Down syndrome in an infant? So small tongue, transverse palmar freeze, large nose, or restricted joint movement. So the right answer will be the transverse palmar freeze will be the right answer. Now the next is majority of newborn babies should pass urine within 12 hours, 24 hours, 48 hours, or 72 hours after birth. So the right answer is 48 hours after birth. Now the next is the ideal fluid replacement in a child having diarrhea and dehydration is normal saline, 5% dextrose, Ringal lactate, or are all are equally good. So the ideal fluid will be the RL, Ringal lactate. Now the next is which of the following is most consistent with non-organic recurring abdominal pain in children? तो ये क्वेश्चन जो है दोबारा से रिपीट हो रहा है. ठीक है, तो इसमें जो राइट आंसर है हमने पहले भी देखा है दैट इज सिम्टम्स आर एग्रावेटेड ड्यूरिंग टाइम ऑफ टेंशन और स्ट्रेस. नाउ द नेक्स्ट इज इकोलेलिया इज, तो इकोलेलिया क्या है? दैट इज रिपीटिशन ऑफ स्पीच ऑफ एन अदर person. Now the next is which of the following drug has highest toxicity to the child? So the right answer is option number D, that is paracetamol. Now the next is the guidelines for writing an appropriate nursing diagnosis include all of the following except. So इसमें क्या except है? So the right answer is using nursing terminologies to describe patient's response. ठीक है. Now the next is drug that cause expulsion of gas from interstitial tract is known as carminatives. That type of enema is known as carminatives. Now decrease in response with particular amount of drug is known as tolerance. And the next is most commonly used model of care in ICU are the right answer is total patient care. That's why in the ICUs, the nurse patient ratio is 1:1. Now the next is which of the following medication is not used during modified ECT? So and the options are haloperidol, thiopental, sodium, atropine or succinyl choline. So the right answer is haloperidol is not means used during the modified ECT. Now the next is perception of stimulus in the absence of an actual stimuli is known as hallucination. Now the next is the manic patient who is on lithium complain about polyuria, prolonged vomiting and diarrhea to the nurse. The most important priority action should be measure BP and offer ORS, instruct client to avoid alcohol, hold lithium and notify to the psychiatrist, and instruct client to take lithium regularly. So the right answer will be the option number C, that is hold lithium and notify the psychiatrist because it can be due to lithium toxicity. Now the next is pretty 12-month-old girl is getting 900 ml N by 3 in 5% dextrose. Drop factor is 60 drops per ml in 24 hours. The nurse should regulate the IV drop to run at. तो इसमें अगर हम देखते हैं टोटल फ्लूइड हमारे पास 900 ml है, ड्रॉप फैक्टर 60 है एंड 24 आवर्स है. 24 आवर्स को वी आर सपोज टू चेंज इनटू 60 इनटू मिनट्स. तो फॉर दैट वी विल मल्टीप्लाई इट विद 60. तो 60/60 जो है वो माइनस हो जाएगा, तो 900 डिवाइडेड बाई 24 रह जाता है हमारे पास. तो द राइट आंसर विल बी 38 ड्रॉप्स पर मिनट. जब हम कैलकुलेट करते हैं तो 37.5 ml बन रहा है. तो दैट राउंड फिगर में दैट विल बी 38 ड्रॉप्स पर मिनट. Now the next question is when pediatric nurse is inserting a nasogastric tube to a toddler, which of the following restraint would be the most appropriate for nurse to use during NG tube insertion? So that is mummy restraint, elbow restraint, clove hitch restraint or jacket restraint. So the right answer will be the mummy restraint because तभी जो baby है उसकी पूरी body जो है उसको हम control कर सकते हैं, वो ज़्यादा हिलेगा नहीं. Then the next is the type of delusion most commonly seen in manic patient is. So right answer is delusion of grandiosity. जो है grandiosity delusion जो है वो हमें देखने को मिलता है manic patients में. Now the next is skin breaks, abrasion, blister or shallow crater, edema and infection are characterized in stage 2 pressure ulcer. Now the next is a systematic abstract explanation of some aspect of reality is called, that is known as theory. Now the next is psychosexual development theory is given by, and the options are Sigmund Freud, Erikson, Paget or Colburn. So the right answer is psychosexual is given by Sigmund Freud. Now the next is for how long we can store expressed breast milk at room temperature. So the right answer is 8 hours. Now the next is the earliest indicator of protein energy malnutrition is skin changes, hair changes, edema or underweight for age. So the earliest indicator है that is underweight for age. इसके अलावा बाकी जो changes हैं that are the chronic changes. Now the next is deficiency of which vitamin is not seen in newborn, and the options are vitamin E, D, C, K. So the right answer is deficiency of vitamin E is not seen in newborn. Now the next is the nurse assess the result of which lab study to monitor for adverse effect from drug clozapine. So platelet count, blood glucose level, white blood cell or liver function test. So the right answer is option number C, that is white blood cell count. So clozapine जब भी हम पेशेंट को देते हैं तो हमने WBCs को मॉनिटर करना होता है. Now the next is disorder of consciousness in which patient remain motionless and mute is known as confusion, clouding of consciousness, hallucination, and stupor. So the right answer is stupor. Now the next is when recording blood pressure, the sounds which can be heard with the stethoscope placed over the artery is termed as wheezing, murmur, crackle sound or Korsakoff sound. So the right answer is Korsakoff sounds. Option number D जो है that is the right answer. Now इसके अलावा wheeze, murmur और crackle sounds are the abnormal sounds. When caring for the client with femoral venous catheter, it is essential for nurse to जब भी हम केयर करते हैं पेशेंट का तो सबसे मेन चीज क्या है हमें कि जो फ्रीक्वेंट फ्लशिंग ऑफ कैथेटर विद सलाइन इज रिक्वायर्ड. नाउ द नेक्स्ट इज डिसऑर्डर ऑफ मोटर एक्टिविटी इन विच द पेशेंट constantly maintain a position without any movement is known as cataplexy. Option number B is the right answer. Now the next is which of the following is common complication to pregnancy that can lead to preterm labor? So that is gestational diabetes, preeclampsia, ectopic pregnancy, or placenta previa. So the right answer is option number B, that is preeclampsia. Now the next is which of the following is not a sign of preterm labor? Regular contraction with increase in strength and frequency, vaginal bleeding, decreased fetal movement, or feeling of fullness or pressure in the pelvis. So इसमें option number जो C है that is not a means sign of preterm labor. Means अगर decreased fetal movements हैं तो that is a concern. Means the female has to contact with the medical officer कि why there is decreased fetal movement. Now the next is which of the following complication associated with tracheostomy tube? So the right answer is that is damage to the laryngeal nerve. So that is the major complication of tracheostomy tube. Now the next is adverse advantages during a pen-like insulin delivery devices are, and the options are accurate dose delivery, shorter injection time, low cost with reusable insulin cartilages and use of smaller gauge needle. तो इसमें जो मेन है दैट इज एक्यूरेट डोज डिलीवरी, जो हमारी एक्यूरेसी है वो बनी रहती है. नाउ द नेक्स्ट इज द नर्स इज अवेयर इन द अर्ली indicator of hypoxia in unconscious client is, and the option number D is the right answer, that is early sign of hypoxia is restlessness. Now the next is the sudden irregular aimless involuntary movement found in rheumatic fever is known as, and the right answer is chorea, that is known as chorea. Now the next is a woman in labor is receiving an antibiotic. She suddenly complains of trouble breathing, weakness, nausea, dizziness, and skin reaction. The nurse should recognize that the signs are usually indicative of impending anaphylaxis reaction. So the right answer is option number C. Now the next is which of the following condition has an increased risk for development of hyperkalemia? So the right answer is option number D, end stage renal disease. So ESRD में जो पेशेंट जो है वो मेनली हाइपरकेलेमिया के साथ प्रेजेंट होते हैं. इसके बाद हमारे ये क्वेश्चंस रह गए थे. सो द क्वेश्चन इज कि when the drug is introduced in the bone marrow, the route is called. So the right answer is option number C, that is intramedullary. Then the quantity of adrenaline is 100 ml of 1 in 1000 solution is, and the right answer is that is 0.1 gram. Then the 5 pint is same as, that is 25 ml. So 1 pint is 5 ml, 500 ml. So 5 will be 5 into 500, that is 25 ml. इसके बाद हमारा next question है which of the following is the most common trisomy? So the right answer is option number B, that is trisomy 21, that is Down syndrome. Now the next is an ABG analysis report shows pH 7.2, PCO2 35, HCO3 20, and these findings are suggestive of, अगर हम इसमें देखते हैं तो हमारा जो pH की वैल्यू होनी चाहिए that should be 7.35 to 7.45, तो वो हमारी कम है, तो दैट शोज दैट एसिडिक। और इसमें अगर हम बाइकार्बोनेट्स और हमारे इसकी वैल्यू देखते हैं CO2 की, सो इसमें जो हमारी CO2 की जो वैल्यू है दैट इज ओके, बट HCO3 जो बाइकार्बोनेट्स है उनकी जो वैल्यू है वो कम है, so that suggests that the patient is having metabolic acidosis, बिकॉज जो हमारे बाइकार्बोनेट्स हैं वो मेटाबॉलिक को डिनोट करते हैं, और PCO2 हमारा जो है वो रेस्पिरेटरी को डोनेट करता है। ये हमारी नॉर्मल रेंज में है, ये भी हमारा कम है, ये भी हमारा कम है, तो दैट शोज दैट द पेशेंट इज हैविंग मेटाबॉलिक एसिडोसिस। नाउ द नेक्स्ट इज xerostomia means inflammation of the stomach, dry mouth, hair loss, difficulty in swallowing. So the right answer is option number B, that is dry mouth. Now the next is a COPD patient is hypersensitive, should avoid the following drug. तो अगर COPD पेशेंट है तो उसमें हम पेशेंट को क्या नहीं देते हैं, तो दैट इज ऑप्शन नंबर ए, दैट इज बीटा ब्लॉकर, बिकॉज बीटा ब्लॉकर कैन लीड टू वेजो कंस्ट्रिक्शन और ब्रोंको कंस्ट्रिक्शन, तो जो पेशेंट के साइन एंड सिम्टम्स है वो और ज्यादा एडवर्स हो जाएंगे। Now the next is atropine sulfate is contraindicated in all except one of the following client. A client with high blood pressure, high blood, a client with bowel obstruction, a client with glaucoma, or a client with UTI. So the right answer is a client with glaucoma. Now the next is nurse should recognize that fluid shift in and client with burn injuries result from increased in the, so जो blue हमारा जो fluid shift होता है in the burn injury, that is due to the permeability of the capillary walls. Now the next is Karan has been diagnosed with aplastic anemia. Has been diagnosed with aplastic anemia. So the nurse monitor for changes in which of the following physiological function. तो aplastic anemia है तो उसमें हम किस चीज के लिए देखेंगे पेशेंट को? We will look patient for the bleeding tendencies. Now the next is the doctor writes an order to infuse a solution. So the order reads infusion 300 ml over 6 hours. What is the hourly rate? ml per hour. So हमारे पास total fluid कितना है? 300 ml. Then हमारे पास time कितना है? 6 hours. So that we are supposed to change into minutes. So we will multiply it with 60. और जो हमारा adult है, जो मतलब person को हम दे रहे हैं, तो उसमें हम हमारा 15 रखेंगे ड्रॉप फैक्टर। तो अगर हम इन्हीं सबको मल्टीप्लाई करके देखते हैं, सो द राइट आंसर विल बी ऑप्शन नंबर ए, दैट इज 50 ml पर आवर। सो आज की वीडियो में हमने 100 क्वेश्चंस डिस्कस किए हैं, बाकी की जो 100 क्वेश्चंस हैं वो हम नेक्स्ट वीडियो में डिस्कस करेंगे। थैंक यू।